Questions. Questions. When there are questions, there are answers. But there also could be answers to the question based on answering or questioning the answers. I know it sounds kind of crazy, right? But that's what we're going to map out today. We're going to be asking questions, but we also may be questioning the answers. Today on 32 questions, 4 quadrants of questions with a specialist. This is our video series where we ask questions that highlight the different dental specialties and focal areas within the dental profession, so that we gain more insight to life as a practicing dentist or healthcare professional and or a resident in trading. So today, on the New Dentist Podcast Show, we're going to be talking with a specialist. So be sure that if you're interested in this specialty that we're going to be highlighting today, that you stay tuned, take notes. All right. Also, be sure that you continue to like, comment, and share this information. This episode of Ask Dr. Darwin, a new Dentist Podcast Show, is being brought to you by GetIntoDentalResidencyChallenge.com. GetIntoDentalResidencyChallenge.com, the ultimate resource that jumpstarts your candidacy when you're applying to residency en route to becoming either a board certified specialist or an advanced trained dentist. For more details, check out the link down below. All right. So we're just going to jump in. Get your notes ready. Push pause and rewind if you didn't hear something correctly, or you didn't think you heard something correctly, so you're taking notes. All right? We're going to be jumping in right now. So, Doc, please share with us your name and where you're from.
Well, first of all, I'd like to thank you for having me. It's my pleasure to come on this podcast and discuss some of the vital things that future dentists need to know. My name is Dr. Gordon Fraser. I'm from Los Angeles, California. I went to school at Howard University, left there and worked in Brooklyn at Brookdale Hospital. And that's where I really found my calling as a dentist.
And what's your specialty right now? What's your specialty?
I'm a periodontist. I call myself a periodontist implantologist, simply because I do a lot of restorative full mouth rehabilitation.
Gotcha. And how long have you been delivering care as a periodontist implantologist?
You know, man, time flies. I'm probably pushing 30 years working on mouth.
No
yes,
way.
Sir, that's a long time. But it seems like half of that.
Right. That's because time flies. Like
half of that because I didn't really figure out what I was doing until 15 years in.
So before you were 15 years in, you had to kind of figure out what you wanted to do. So where did you go to undergrad and what was your major?
So I went to Howard University. I majored in zoology and I minored in chemistry.
Ooh.
And around those times, I thought I wanted to be a physician,
but
I knew I didn't want to be on call as a physician. So I kind of had mixed emotions about what I was going to do, did research as to what I could do, and really hadn't found a landing spot.
Got you. And dental school, what about dental school? Where'd you go to dental school?
I went to Temple University in Philadelphia. Excellent institution, I might add.
That's right. Temple, shout out to Philly. So between Howard undergrad and Temple for dental school, did you take a transition year, a gap year, or did you go right in?
No, I took a couple years actually. The first one was a job in Brooklyn, New York at Brookdale Hospital. I was a unit manager, and I was working late one night, like 2:30 in the morning, and I saw this young lady. She might have been 90 pounds soaking wet, sewing up somebody's face that had some trauma from a baseball bat. And I said to her, I said, "What kind of doctor are you?" And she looked at me. She said, "I'm a dentist." And somehow the bells just went off in my head. Ding, 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 ding. That's it. And so from that moment on, I started to pursue a career in dentistry.
Got you.
From there,
Hmm.
I did what we commonly call a post baccalaureate at a place called Southern Illinois University. Shout out to SIU Salukis. I spent a year there just shoring up my numbers, my grades, my ability to do well on the DAT, and I very fortunately received a scholarship to Temple University.
So you mentioned Temple in Philly. Um, let's talk a little bit about that. What was the thing that you liked most about dental school?
At the at the
It's not a
time,
trick question. It's not a
it
trick
sounds
question.
crazy, but at the time, the best thing I liked about Temple is that the clinic was brand spanking new. Everything was new, so it was kind of like, oh, I could see myself suited up in here, strolling through, dealing with my patients. um, and Philadelphia, and where Temple is, had a large pool of people who needed our services. So we got to have a lot of experiences in dentistry there.
So the new clinic, all the experiences, especially being in the location that the school is at. What was the least favorite part about dental school that you remember?
My boards, I hated the boards, not the boards themselves, but the preparation. It seemed like I spent days upon days upon days reviewing and retesting and going over and not really being able to really gauge how well I was doing or how well I would be prepared. And so you take your boards and then you're just kind of crossing your fingers, hoping that everything comes out okay. And it did, of course, but the whole prep was kind of like trying to absorb everything you possibly can and be able to understand it and then give it back in a way that breeds success.
Now, when you say boards, you mean the written boards, not the
Yeah,
patient
written boards,
licensing
written
boards.
boards.
Got
Yes.
you. Anything else about dental school overall besides the boards that was like, oh man, why are they doing this to me and us?
Well, I probably would say learning to wax up teeth was always very interesting. We had these benches in our laboratory where they would give us, wax up a molar, wax up a premolar, and regardless of how nice I thought my wax up was, it was just there was always something missing. There was always something that wasn't quite right. And it just seemed like a never vicious ending circle of spending hours in the lab waxing up and waxing up. And that was something that I didn't particularly love.
What else did you love as far as things that were hard that you remember in dental school? What were some of the hardest part
You
about
know,
dental school, and how did you overcome it? Because there's probably some people that are listening, watching that are either in school now or will be going into matriculating soon, so they need to know some of these hard things so they have a an idea. So hardest part about dental school and how
I
you
think
overcame it.
the hardest thing for dental school, at least at the beginning, was finding the right group of people for me to latch on to and learn
Mm,
with. Uh, there are some folks who can go through school and do everything by themselves, but I'm more of a social person. I learn from other people. So when I found my group, not only did I enjoy being with those folks, but we taught each other.
hmm
And once you
hmm
start to understand that people see things in different ways and learn in different ways, you can start to have a all-encompassing view of whatever it is you're studying, and it breeds confidence because now you know what other people are thinking and they know what you're thinking, And once you get all of that together, you have a much better opportunity to hit the mark.
Yeah, finding your group, finding your core of colleagues that will uplift you and you uplift them is key
Absolutely.
to survival, man. I can't even I can't say that I graduated from dental school by myself. It's like so many of a tribe or a village of classmates, upper class and even lower class too, right?
Absolutely. Absolutely.
That's key.
Absolutely.
So on
Especially
that first,
when you get to
oh,
the clinic,
oh yeah,
upperclassmen are there for you in terms of handing over cases that need to be finished,
yeah.
uh, giving you ideas on how to get lab work done, pointing
Hmm.
you in the right directions. So yes, it's key in terms of making it through.
On that first day at dental school at Temple, did you know which specialty or focal area that you wanted to kind of be immersed in?
Well,
Um,
I knew I wanted to go into surgery. And
Surgery.
for the
Okay.
longest time, I thought I was going to go into oral surgery. But after having an experience in periodontics, which probably came in my junior year, I
Mm,
realized that was my sweet spot. For me, I think oral surgery veered too far away from the art and science of actual dentistry, whereas periodontics has such an intimate role with the mouth, the teeth, how they fit. Um, for instance, biological width and crown lengthening. I mean, they go hand in hand. And so it became very important for me to understand the restorative aspects of dentistry in order to be a good periodontist.
was there a specialty that you knew you definitely did not want to explore? Or was that
Endo.
too? Or was endo?
I just thought endo was monotonous. I always would say, how could you do the same thing over and over, day after day after day after day? Endo was just one that I just did not see as something I could do.
Right. So you mentioned, and we're going to pivot now to the second quadrant here, talking about perio. You mentioned that around D3 year was when you started focusing on perio. What about perio made you fall in love with it as early as D3 year?
I walked into the perio unit, and at Temple, you had to do time in each specialty so you could kind of figure out what you wanted to do and kind of learn more about it. And I walked into perio, and they were doing an implant case. And this is back in like 93, 94, where implants weren't as prevalent as they are today. And I just thought that was the coolest thing ever. And immediately I tried it on, and this is a great fit. It was like a custom made situation just for me. I was supposed to be in there and supposed to see that, and I really fell in love with periodontics when I saw dental implants being placed.
Yeah, I remember that time being in dental school in the 90s, and there was just so much talk about implants. Uh, and unbeknownst to many, we in the US were actually a little bit late getting to implants.
Yes, sir.
Right? Over in the European countries, they were already not only placing implants, Denmark, Sweden, and other locations, but they were way beyond where the U.S. trained dentists were at the time. But it was a great time to kind of learn all these new innovations, and thank goodness for the internet, so to speak. I mean, then you were able to find more things that were online that were published, right? But implants, definitely,
Absolutely. Absolutely. The Europeans did a lot of things differently. And one thing
right.
that since you mentioned that, one of the things that really opened my eyes is that in Europe, they would freely place implants into the sinus with no graft.
No
And I
grafts.
thought,
Yep.
we had been taught that that's absolutely a no-no. And that's what really opened my mind to being able to think independently about surgery and restorative dentistry based on what it is that's in front of me. So in other words, periodontics is kind of a specialty where folks think that it's for people of excess, people who have lots of money. But being a brother, most of my patients not only don't have a lot of money, but really rather just take the tooth out than cover a root or save a tooth simply because of the economics. So it became very important to me to educate and to educate them why teeth are so important. And so I married that with my periodontics, and I feel that I've created a very, very valuable aspect or niche of dentistry.
Now you talk about the niche of dentistry as it relates to perio. Um, and before you can create that niche, you got to do some training. So what's typically, how long is the training for perio, including if there are fellowships, uh, or any special research things that most periodontists in training should consider in order to become board certified overall?
Yes. So first of all, you want to go to a certified perio program. The program is a minimum of 3 years. If anybody tells you they did perio in less than 3 years, they didn't do perio. Perio training is 3 years. You need to go to a certified program, and then once you finish that program, I would highly recommend putting yourself in a situation where you can hone your skills. And for me, I gained a scholarship to the United States Air Force. And what that did for me is it sent me and my family to Japan. And I spent 3 years in Japan doing everything and anything under the sun for patients without having to worry about how it was going to be paid for. So when I left that program, I had the tools, the experience, and the confidence to enter private practice and do well.
So you mentioned honing your skills and the importance of doing that even after training. Um, you were so you decided to join the Air Force as a dentist, already as a specialist as well, correct?
That's correct. I went in as a periodontist, stationed over in Okinawa, Japan. As you can imagine, there was probably officers, maybe two or three of us in total,
Yep.
brothers and sisters. Um, but I went there, and not only did I learn a lot about periodontics, but my office suite partner was a prosthodontist.
Mm,
And we really collaborated on some things, and it was just a wonderful experience. I would say as valuable as my residency.
absolutely. And that's where you have the interdisciplinary care and treatment. And again, I meant to say this, but thank you for your service, fellow U.S. Air Force officer and doctor. I was stationed in Korea, not too far from Okinawa at Kunsan Air Force Base.
Yeah. Thank you
So
for your
thank you for your
service.
service. And you're right, man.
Likewise.
That training, whether you train within the military healthcare residency programs, or even if you come into the military like you did with that specialty training, that's one of the things that's really unique about those experiences because you're there with other specialists and you're working together, especially with things like implants, right? Um, in my experiences as well, working with the prosthodontist, uh, the periodontist, right? In some cases, even the endodontist. And as the restorative dentist, we all collaborated and we had what we call kind of like an implant council where anyone that was potentially treatment planned or recommended for implants or something similar on the restorative phase, we all met together, and that was allowed us the opportunity to collaborate and to really, like you said, hone in skills or even continue to develop those skills that are necessary for the best outcomes. Now, if for some reason people that are listening and watching do not want to say go to the military and go through that path after residency training, what else could they do that's something similar to be able to, like you said, your recommendation to really hone in their skills afterwards?
Well, there are community health based systems, which a lot of my colleagues went into. Um, you have more than ample supply of patients that are willing to let somebody who is just getting into the field practice, because that's what we are in the practice of dentistry, work on them. You find that a large number of those people are very thankful and grateful for those services and you being there. So you start to develop what doctors need to have is an appreciation for
Mm.
what it is you're doing for people. See, what can happen is if we didn't have to do the work to become really good and you just got out of school and people were paying you a whole lot of money to do things, you wouldn't appreciate what it takes and the fine tuning that's involved in order to have consistent outcomes. I would
Mhm.
definitely say community based. Uh, I think volunteering. When I first came to Atlanta, I spent 3 months in just about every periodontist office who would let me in. And fortunately, I hooked up with a very nice periodontist. His name was Dr. Michael McDivitt. He was known at the time as one of the best grafting doctors in the city. I went to his office every single day. He began his day at 6 a.m. And when he invited me, he didn't think I would last as long as I did because most people that he invited would come for a week and say, okay, well, I'm good now. Well, I came there for a month straight. And when I told him, okay, well, thank you for everything, he offered me a position. He offered me a position in his office, which at the time I was not interested in taking. And that's because in my mind, I had worked for the largest company in the United States Air Force. I had taken side jobs working for, the Nanstons and the Great Expressions and all those little places that are what we call kind of DSOs now to kind of pay the bills. And in my mind, I always thought, I want to have my own practice. I want to run the show. I want to do it my way. I want to be able to take what I've learned and flip it and twist it in a way that I can serve people who otherwise wouldn't get this service.
That's right. You talk about the service that you provide as a periodontist and implantologist. What do you think is the most unique part about perio? What makes perio so unique and as it differentiates or stands out slightly above or equal to other specialties?
I'm so glad you asked me that. And I'm going to give a description that makes the light bulb go off in my patients' minds when they come to see me after they've been diagnosed with periodontal disease from their general dentist, sometimes prosthodontist, but other doctors send advanced perio to me. And I am always flabbergasted by how little patients really understand. So let me tell you and show you how I do that. Periodontal disease is like catching a cold. When you catch a cold, your nose gets inflamed and stuffy. Your body's immune system is trying to attack the bacteria. The body creates mucus. The mucus encapsulates that bacteria. You blow it out, cold goes away. Well, in periodontal disease, the system is somewhat similar in that there's bacteria in the mouth. That bacteria is alive and it secretes toxins into the tissues, which alert your immune system, which then wants to go get it. Well, the gums get stuffy, inflamed, like the nose. You brush and you see blood. Well, that's the body's way of trying to get to the bacteria. If it goes untreated at that point, the body turns on itself and begins to eat the bone away from around the teeth in the hopes that one day that tooth will fall out and the body's done its job of protecting itself. And when I say that to patients, I get this look of, oh man, if I would have known that, I would floss. And so then I go into teaching them techniques and ways to be consistent, such as if you floss every time you take a shower for 90 days, at the end of that 90 days, if you take a shower and forget to floss, you're going to feel like maybe I forgot to wash under my arms. But it's the flossing. And so you start to get consistent and you see better results.
Flossing matters. Hashtag flossing matters.
My
Uh,
license plate on my car reads FLOSSM. And at least once a week, someone's like, oh, you're a dentist, aren't you? You're a dentist.
that's right. That's right.
Awesome.
Flawsome. Hey everyone, it's DrDarwin. Just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. So, uniqueness. So thanks for sharing that.
Absolutely.
Again, we got some people that are listening and watching. Why should someone consider perio or choose perio? Why should they?
If you really love dentistry and you love the surgical aspects of dentistry as well as the restorative aspects of dentistry, it's a perfect marriage because you have to learn both. You can't be a good periodontist and not know what your referring doctor needs to restore. I often say that the job of the periodontist is to make my generalist look good. He paints the picture, I make sure the frame is right on time. And when you can do that, you'll find success.
The frame and those things that are the frame is supported by in the wall,
Absolutely.
right?
Absolutely.
The foundation, right?
Yes, sir. You
You
can't build without a firm foundation.
can't build it. You can't build it. And people need to know just because you can't see the foundation doesn't mean the foundation doesn't exist, or just because it doesn't hurt doesn't mean that it's not faulty or doesn't have a crack in it or doesn't have a lot of support left, may only have 50% left. Just because it doesn't hurt, just because you can't see it, doesn't mean that they ain't something wrong, so to speak, right?
That's correct.
So that foundation is key.
One of the things that I tell patients is it's like cancer. When it hurts, you got a problem.
Right. It's too late then.
It's too late. Too late.
It's too late. Right. When the tooth is going like this, it's too late. It's too
It's too
late.
late.
All right. So for those that are who are surgically inclined or maybe want to do surgery and also have a those that also have a understanding of the restorative aspect of what they're doing surgery wise, those are reasons for folks to consider perio. Let's flip it. What about the other side, which is why should someone not consider perio?
If you don't like studying literature, if you don't like reading, if you don't like really getting hammered, don't do perio. Because I'm telling you, they're going to ask you who wrote what, who told what, and why what is what.
But wait a minute, Doc. Doesn't that occur with all the specialties, especially endo, right?
It does. It
Pedo as
does.
well.
It does.
So,
It does.
so,
But I
mhm.
think that when you're talking about endo, it's specific to endo. When you're talking about perio, it's not just perio. You're going into oral biology. You're going into bone biology. You're going into soft tissue biology. So it's a milieu of different things that come together that you have to be very knowledgeable about in order to have success and know why to do and not to do certain things, or what will and what won't work in terms of, for simple, you can't graft where there's no blood supply. And a quick question would be, who wrote that?
Right. What year? What journal? What was the outcome? What else should people consider that will make them maybe not be inclined to perio? You mentioned one who those that maybe don't want to do a deeper dive into the critical appraisal of not only literature but also using that literature and research as a foundational part of their understanding of the specialty. What else? Anything else?
Well, yeah, if you got a weak stomach, not the place to go. Because I'm telling you, you see some funky, funky, funky stuff. In terms
Yeah.
of you, I can tell you if somebody has perio when they hit the room. I know I just that special smell that I can smell that I know what's happening. But
Even with a mask on? Even with a mask on?
hey, if I can smell it with the mask on, it's a real problem. We're going straight to surgery. But what I will say is, there's a certain kind of mouth-watering joy that can come about from being able to open flap and clean somebody's teeth and then put it back together again, and then 2 weeks later see a recovery. Open it and making sure you're getting every last bit of. There's just something that wants you to make sure that it's done well. And when you get that feeling, you know you're in the right place. It's not, you in every specialty or every field of human endeavor, you've got the people who are supposed to be there, the people who shouldn't be there, and the people who are just there because they happen to be there. And when you have the kind of urge to kind of go get it and be better and add to the specialty, you know you're in the right place.
So that sounds like a perfectionist, which may also sound like many of us as dentists, right? Type A personality, but maybe a little bit more to the nth degree as a periodontist. So that makes me think of stereotypes. Are there stereotypes uh about periodontists or
Yeah.
implantologists? What's the stereotypes? And
Those,
if so, are those true or are they just
well,
words that people say?
I would say that it depends, like any stereotype. I think I probably fit the stereotype in being kind of obsessive compulsive about making sure everything is just so and just right. According to my wife, I spend entirely too much money and time on the latest and the greatest because I feel like if I don't do it, who's going to do it? And who's going to do it for folks that look like me? And so I find myself kind of not really at the end of my career, but maybe at the peak of my career. But I find myself in places with much younger periodontists, learning new techniques, learning about this digital dentistry. I remember there was a time when I thought I was the man because I was always the youngest in the room. And it seems like in a blink of an eye, now I'm the oldest. I'm giving a lecture one time and I'm getting a question. It's a webinar. I'm getting a question. This is what, where are the surgical guides? Well, where's this the intraoral scanning? And I'm thinking to myself, man, I make my analog guide, and that's how And I realized that wow, I've become the doctors that I used to quote unquote talk shit about because they didn't want to keep up with what's happening. And I'm going to tell you, folks, dentistry is changing before our very eyes. We are seeing a change in what we do and how we do it. And because of that, either you stay in it and learn it or get left behind.
Yeah, and being left behind is should can't happen in a
No,
profession
no.
like dentistry where it's a profession of lifelong learning, right?
Always lifelong learning. And more importantly, you got to invest in yourself. A lot of
Oh
these
yeah.
courses aren't cheap, but you
No,
got to
no.
invest in yourself. There is a huge ROI for
Right.
staying on top and really enjoying what you're doing. You meet a
Well,
lot of
that's
great
what
people as well.
well, that's what you're supposed to do as an expert, right?
Yes, sir.
Whether
Yes,
you're a
sir.
specialist or not, you're still an expert as a dentist, right?
That's
We are the
absolutely.
oral physicians of of the body.
You know something that's really interesting? We as dentists know more about the body than physicians know about teeth.
Absolutely. Which is a whole nother conversation, which we're gonna have. We're gonna talk about the why oral health matters and how it's already integrated into health, but separated in title, especially titles when we're called dentists and other doctors or physicians are called doctors, but dentists are not called doctor. That's a whole other conversation for another day, but we may touch on that in a little bit. I want to touch on now what an average day looks like as a periodontist. So we're going to pivot now into this third quadrant of questions. And for those of you that are listening, watching, if you finding some of this information valuable, hit a thumbs up. Put in the chat, please. Also, this is good, so that we know. Give us some feedback. All right. So we're going to pivot to the third quadrant of questions, focusing more now on what a typical day looks like, at least from your perspective and your experiences. So, um, how's it set up? How do you have your day set up in your office currently right now as a periodontist and implantologist?
Well, I'll start off with a typical day and what my day looks like. So I work out in the gym Monday, Wednesday, Friday. I wake up at 4 a.m. I'm in the gym by 5. I'm in the office by 8 a.m. 8:30, we have a morning huddle. We go through the day's activities. We assign assistants to new patients. We assign assistants to certain procedures. We make sure that we have everything that we need for that particular day. Um, and in getting into the day, I probably see anywhere from 15 to 25 patients a day. It just depends on what it is I'm doing. I like to do all of my surgery before 12 o'clock. I just don't like to do surgery in the afternoons. Number one, I'm not fresh. And number two, a lot of perio patients are elderly and they're at their best earlier in the day as well. And it's
So, Doc,
always,
real
yes,
quick, Doc, you said something that I want to make sure that we didn't miss,
sure.
and it may be something other people have heard too. You said 15 to 25 patients a day.
Yes, sir. Yes, sir.
So can you can
Yes.
you can you
So,
can you give us some context to that? Because people who may be listening, watching, may be like, "Well, I don't want to be a specialist to be doing that. To be seeing that
well,
many patients."
you don't have to, but as a periodontist, as a black periodontist, there are so many of us that need the services a periodontist provides. And in order for me to even make a quote unquote dent in that, it becomes imperative that I see enough patients to impart this information. Now, I started off with a 3-chair office, and I always felt like I needed more chairs. I needed more chairs. So we expanded to 6. Now, some days I'll have another doctor in with me, but most days I'm by myself. And so the way that I set it up is that I'm either doing a reevaluation, a consult, or a treatment plan in one of those 3 rooms. And my assistants have been trained to be able to provide different things that they can provide, which allows me to keep moving. Now, I do a lot of dentures, and you'd probably be hard pressed to find another periodontist that does dentures. But I do dentures because it's a great segue into implants, overdentures, fixed hybrids. These are all things that we provide, which is why I say full mouth rehabilitation. And so, in order to do that, we have models. Each of my assistants have been well educated so that they can impart that knowledge to each of the patients. And so, we just have a nice, very well oiled machine in terms of being able to get people through the process and allow them to make a decision. Now, my philosophy is your reason for coming to see me is not to necessarily get anything done. It's for me to educate you about your situation so that you can make the best choice for yourself, even if the choice is no service at all. Because when you leave and 2 weeks
That's a
later that
choice.
tooth blows
That's
up,
still that's still a choice.
you're absolutely right. You leave and 2 weeks later that tooth blows up. The last thing I want you to be able to say is, "I was just at the dentist. They didn't say anything about this." Oh,
Right.
Dr. Fraser told me about this. Let me go. Let me give him a call and tell him is happening, right? So people can be prepared for what's coming down the line so that if they're not financially ready now, they can get ready.
Right. You made you shared a little bit about your setup as far as how you're able to see that number of patients and people because of the need that's in the community, or at least the community that you have developed through referrals. My question related to that is how are you finding people are being receptive to, number one, being referred by their possibly their general dentist or another specialist to the periodontist, and then number two, what h- how that referral, how you are continuing to develop that referral base, because most patients will think a dentist is a dentist is a dentist, right? Not understanding that maybe there are some specialists uh, that have a unique expertise and focal area, right? So how, I'm just curious as to for those that are listening, watching that may have a similar thought like I do. It says how are you able to maintain those relationships not only with the patients who are coming, which seems like a lot, but also those that are being how they are being referred from other colleagues.
Okay, so when I first got started, I gave free seminars on what a periodontist does and how we do it, and what's possible and what's not. So many of you out there may or may not know what Miller's classification is. But Miller's classification is a system by which we can determine the outcome of a soft tissue procedure prior to ever doing anything. And at least in my neck of the woods, most of my general dentists had no idea what Miller's classification is or was. And so by imparting that information to them, they now begin to not only have a better understanding, but they are better able to refer and have an expectation of what their patient should look like when they come back. So, in other words, you refer a patient to a specialist. If you don't have a relationship with that specialist, shame on you. Your specialist, you should be able to call and ask or say just about anything that needs to be said pertaining to that patient. And if you don't, you'll get back what you expect, which most of the time may be a patient who has no more insurance money and has work done that you might not even have seen. And I say that to say, when my doctors send me a patient, they are specific as to what they want me to do. Sometimes it's, hey, do everything you can for this patient. But sometimes it's, well, we need root coverage on number 22, and we're planning to do restorative here, there, wherever. And that's what I do. Our office is known for returning patients back to their generalist, even when their patients say, oh, well, can't you do that? Can I stay here? We've been blessed with assistants that have this uncanny ability to laugh and have a good time and make a connection with our patients. And they, a lot of times, want to stay with us. But if they were referred from another office, they cannot stay.
Got you.
I will also follow up with a letter stating what I did, what my treatment plan was, and outlining some of the things that I see so that we can discuss, all right, is this something that Miss Jones may need next year or the year after? How do we maintain and keep her healthy until such time she's prepared to do whatever it is?
And that could be a challenge, right? Because there are different things uh, that patients have to consider, and also that coordination between the two offices. As a general dentist, as kind of like the quarterback, uh, and or you as the quarterback, but the general dentist is like the head coach, but all working together on the same team. Um, and that's key. Also key is working together on some of those hard and challenging cases, right? Or procedures. What would you say over the years that you've been practicing and delivering care has been some of the hardest or most challenging procedures that you've worked on?
Full mouth rehabilitation is always the most difficult because there are so many different aspects that come into play, i.e., the bite, jaw position, aesthetics, function, but most importantly, believe it or not, patient compliance. People will tell you, oh no, doc, I don't smoke.
Or
Meanwhile,
or lack thereof.
exactly. So, being able to motivate folks to stay on track and do what they need to do in order to have success, I think is probably the most difficult thing to do because everything else you'll be trained to do. And once you've done it 3, 4, 5, 6, 7, you can see the result prior to even doing whatever it is you need to do because we have great technologies, CBCT, intraoral scan. We have all these things that take the guesswork out. When I first started, we had 2D pan, and you go in there and you got, a knife edge ridge of bone. There's no way that you can get an implant in there without grafting, and it would have been nice to be able to know that beforehand, which we can do now. So we can make the arrangements for things prior to ever even touching the patient.
And you mentioned something important, that whether you're a periodontist, general dentist, endodontist, just a dentist, motivating the patient or the individual who needs the care, wants the care, to make sure that they do their part. And just so people who are listening and watching understand, there's only but so much we can do as our patients or the person that has entrusted us with their care, it's only but so much we can do to help them. They have to do their part too. And it's going to be very key doing your training, doing your career, over the course of your career, that you begin to learn how to understand the psyche of the individual that you're engaged with and trying to
Absolutely.
help, right?
Absolutely.
And unfortunately, we don't get that in school, right? That whole psychology part, interaction, communication, how to be a leader in communication, but also to lead and communicate to serve the individual. And there will be some individuals that you just won't be able to help.
Yeah. Yeah.
So you have to understand that. You have to understand that dynamic because that will impact how you're able to, quote unquote, motivate someone. You need to find out from them what motivates them, right? Is it the fear of pain or fear of the unknown, or in this case, fear of losing some teeth in the front and top and bottom so that they can't smile? Don't know. But you have to identify and discover that by doing what? Asking questions, right? Knowing how to ask questions and finding out because you may have this vainglorious treatment plan that will never work because it involves the participation of the patient, and you got Miss Jones or Mr. Smith and they ain't participating, right? So that I just wanted to mention that as it relates to challenging because that's a challenge too with all the things that we do. Being able to connect with individuals, but also making sure that those individuals that we tap into those things that are important to them as far as final outcomes or what they desire, what their future desired outcome is, and how to tap into that to have them help you help them.
As you go through your career too, you also realize that it's almost human nature. For instance, you have a young person come in and they've been seeing you for a while, and you're telling them what's coming down the road, and lo and behold, they end up losing a tooth. And you're thinking to yourself, man, how many times did I tell this person, or how many times did we talk about this particular area of the mouth, and yet nothing was done. But after you remove that tooth and say you replace it with the implant, and now you're seeing this patient's like, what happened? It's like night and day. They're actually adhering to what they need to adhere to because they had suffered the consequences. I.e., you got people who won't stop smoking, they have a heart attack, and now they're the picture of health. And then you also have some that go through the same circumstances and still do what they do in their own detriment. So creating that relationship becomes very important so that your patients understand that you can't come in here and make your problems belong to me, which a lot like to do.
Absolutely. It's easy to do that.
Yep.
Um, let's talk about not an easy procedure, but your most common procedure or routine procedure that's routine in your office. I think I know the answer based on what how you introduce yourself earlier, but I want to hear. We want to hear what's your
I
most
would
common.
say the most common procedure I do, bar none, every day is extraction and bone grafting, whether it be
Mm.
for future implant, whether it be immediate load implant, whether it be for overdenture. It's definitely extraction and bone grafting.
What's give us a case that's probably been one that you worked on that's been the most memorable or the one that gave you the best feeling.
So when I first started doing digital, we digital hybrid. So we print 3D print an arch of teeth and load it onto implants. And in order for me to get my foot in and start to gain some experience, I had a special. I would do 4 implants in a hybrid for a set amount of money, regardless. So I had this brother come in, decides that's what he wants to have done, Everyone's excited. Seems like a very nice guy. And we do the procedure. He leaves. He's happy. I'm happy. I'm feeling accomplished. 2 weeks later, he comes back and everything's wiggling and wobbling. And I'm thinking to myself, what did I miss? What's going on? Hopefully it's just the screws are loose. Well, upon further investigation, he's losing the implants. As we had conversation about what was going on, he didn't do what he's supposed to do. I told him, you've got to be on soft foods for at least the next 3 weeks. Salmon, potatoes, anything that's soft. He admits to going out and going to town on anything and everything. And that was because he said it felt solid. Everything felt so real.
I forgot. I forgot.
And so where does that leave us? That left me with having to replace all of that work. Now, one of my philosophies is different than most, but our folks really don't like paying for the same thing twice, especially or even if it's their fault. So one of my policies are: if you stay in my maintenance program and don't miss any maintenance, if you have a problem with an implant, I replace it at minimal cost. So if you're paying $2,000 for an implant and you lose it while in my care, you might pay $200 to replace it. This gentleman had not been in my care long enough, but because of his sincerity and honesty, we did the whole case again for nothing. And not only do I think that that is probably my best marketing strategy, but that news spreads like wildfire. And that is Dr. Fraser is here for us.
Yeah,
He's going to do what's in our best interest, even if it cost him.
right. Well,
And you don't find that very often.
well, and let's be clear too. So just so it's level set. It's gonna cost. It costs everybody something, right?
Absolutely.
Whether it's you as the provider, it costs your time, and then also your staff's time. You got material costs, right? But it also costs the patient some time too, even though they may not be paying for those material costs, but they're paying in their own time too. So it's free, but it ain't free because
Correct.
you gotta pay
But in life,
attention.
it is free.
Right? Ain't nothing free. I mean, life ain't free.
Nothing's
It
free.
it costs us to live, especially when we're not living no more. That's the ultimate cost, but that's a whole nother conversation, right? So, but you also want to be careful with how you practice in some cases because, and that's why communication is so important. Yes, you want people to know that we care about them, right? But you also have to let them know that no, it is going to cost something. It's not free because then you don't want word getting around that, Dr. Hayes, Dr. Fraser, they do free dentistry. Well, we do, but we don't. It's going to cost you something too. So, and
And
that's
and
another,
and when you are working in such a fashion, you do get those folks who will be in there trying to get over it. There's no
yeah,
question about
yeah,
that. No
yeah,
question.
yeah, you got 10% of the people causing 90% of the problems.
Yes, sir.
Absolutely.
Yes, sir.
Absolutely. But just wanted to mention that as well. And that could be a tough part about what we do. Having those expectations from people that are like, well, no, I paid for it. I did this. You didn't tell me that. Blah, 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 are pointing the finger at us, right? Um, so that can be tough. What else can be part of the toughest part as your role as a specialist, a periodontist, a implantologist, full mouth restorationist, so to speak.
So
What's been
so this
and
one.
even as a business owner too, right? I
Oh
mean,
man,
that's part of your
you,
role
you
too.
you hit it on the head, and
Oh,
it's
okay.
it's 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 staff management. It's
Yeah.
your staff thinks you're putting 20s in the basement, and so just being able to manage the different personalities and the different learning styles of the different individuals in the office becomes paramount to having an environment which is drama free.
Yeah, drama free. And with drama free, we're talking about a team, right?
Correct.
That, and again, unfortunately, not something we're taught in dental school, at least not to the extent that it's needed as we continue to go out and be able to deliver service to the public.
And you can't do it by yourself,
No,
right?
can't
And
do it for
because
your
you
tech.
can't do it by yourself, you have to choose these individuals very carefully, because the one thing that costs you more than anything else is training someone and they leave, and training
Yep.
someone and they leave, and training someone and then they leave. That can kind of wear on you after a while. So in making your choices, you learn after a while how to see who are the people that are sincere, really do love dentistry and want to be here.
What did you do over this 15, 20, 30-year career that helped you manage or learn this other aspect about being a business owner and being a leader?
You're not going to
Uh,
believe this. I have had a coach for at
I
least
can believe that.
20 of those 30 years. I had a
Okay.
coach. I learned from someone who had experienced what I was experiencing and learned from them, pointing me in the direction of the right books to read, pointing me in the direction of what courses to take. Without that coaching, I probably would not be in the position I'm in right now.
Yeah. Again, lifelong learning, even if it's not, and will definitely not be only the clinical aspects of what we do, but also the organizational, the operational things that we have to do as to be able to deliver our service as a business, because it is a business,
Putting systems together, putting
all of that.
systems together in such a way that when someone new steps in, that system can be learned instead of having to recreate it, remake it, reshape it. It's got to be in place so that anyone can come in that wants to and learn that position.
Let's talk about, we're going to pivot now to the fourth quadrant before we get to the bonus section. Fourth quadrant, lifestyle, fun. Let's do a quick rapid back and forth with a couple of things.
Okay.
Hours, number of hours worked per week on
I
average.
work I work probably an average of 30 to 35 hours a week.
Now, is that all clinical care, or is that both your multiple roles or multiple hats as owner,
All,
practitioner?
all clinical care. So if we're talking about number of hours that I put in just in running the business as well, you're probably looking at 40, 45, just behind taking care of paperwork, taking care of insurances, payrolls, making sure that workers comp is set up in such a way that if someone is injured, they'll be taken care of. I offer my whole staff health care and 401k. So there are all these other things that come into play, which number one, help people want to stay because they're being taken care of, but also we get the best of the best because they know the environment is one that is supportive.
Right. Number of hours of sleep per night.
I try to get 7 plus, 7 plus. I know how when I wake up and I haven't had enough sleep, it's always in the back of my mind. When I get home tonight, I'm making sure I get sleep.
I'm gonna get these eight
Oh
hours.
yeah,
Mm.
I'm getting to bed.
Now,
That's it. And as you get old now, in my younger years, I could roll on 4 or 5 hours, no problem. But as I began to get older, I started to realize how it affected my performance.
mhm,
And just the way I would spend more time trying to feel the way I wanted to feel in order to perform. And so that's when I started to get my workout program going, trying to eat right, trying to sleep. These are all so important in just being able to replicate the best that I can be.
Yeah, you got to take care of yourself.
Yes,
Uh,
sir.
do you feel like are you also taking care of patients after hours? Like, are you on call? Do you take call? How do you?
I used to work on Saturdays. I worked Saturdays for 15 years of my career. And I just got to a point where I felt like I was cheating myself and not enjoying the fruits of my labor and my time off because I wanted to be so good that I wanted to be available and kind of be everything to everybody, and that's just impossible. So once we started taking Saturdays off, I could feel a much better balance with my family, with my friends, with things that weren't dental related.
Are you a morning or night person?
Oh, morning. I am definitely a morning person. If you catch me awake after 10 o'clock at night, something serious is going on.
Right. All right. Favorite color, favorite food, favorite drink?
Favorite color, black. Always
Black.
been on
Okay.
black. Favorite drink,
Okay.
I enjoy a good bourbon every now and then.
Gotcha. Food?
Food, I'm partial to Caribbean, curry, roti, pepper pot.
Oh wow, you get me hungry, man.
Oh yeah.
Favorite place to visit or vacation? Or what's on
Um,
your list?
so I got married in the Bahamas, and a good colleague of mine lives in the Bahamas.
Hmm.
So we frequent the Bahamas quite a bit. He's got a nice boat, so we go to some of the less inhabited islands. They've even got this one called Rose Island, where all that's there is kind of a bar. And you have to be able to take a boat to get there. There's no other way to get to the island.
Well, y'all might get some new visitors now. You don't told the secret.
Anytime. It's so much fun. I mean, from deep sea fishing to just relaxing on the beach and having a good
Yeah.
time. It's a great environment.
Any other location, I mean vacation locations you got on your list?
On my list, I mean, the whole world. I want to visit the world this summer. I'm going to go to Portugal. I played in a
Mm,
golf tournament with some guys, and one year we play in the States, and the next year we go someplace in the world to play. So this year we're going to go to Portugal, and then of course my wife will join me after the tournament, and then we'll travel in Europe, a few places, and come back.
got you.
My
Favorite?
parents.
Well, you got to add me to that list, man.
Oh,
Add me
okay,
to that golf list. Um,
absolutely.
what's the favorite thing you like to do when you're not in the office?
Um, if I'm not watching a movie or playing golf, I like to motorcycle ride.
Okay.
And I used to be a real big on road rider, but now I'm just doing trails and off road stuff because if something goes wrong, it's on me and not on the person who's on their cell phone not paying attention. That's a good way to be an organ donor. So I've kind of
Right.
given that one.
Right. Right. All right, bonus section. Again, thanks for everyone for following and going all the way through to the end. We got some bonuses for you for listening and paying attention. If for some reason these bonuses escape you, like you're not understanding what we're saying or what have you, push pause, hit rewind, go back, write these down. And not only that, but make sure that you implement what's coming up. So number one, um, what are you finding? What have you found to be some of the most common instructions or tips or health advice that you're giving individuals in your care?
One we talked about earlier, and that was flossing in the shower. The other one is getting your teeth maintained every 4 months instead of every
Mm,
6 months. The
mm,
studies that were done on 6 months were done on 18 to 21-year olds. So their
mm.
regenerative capacity supersedes that of just about everyone else over the age of 30. And so by going every 4 months, you almost ensure that you never have a major tooth problem. And if you should miss one, it hasn't been a whole year since your last
Yeah.
maintenance.
Now, w- we're going back to those articles again, right? The research, the critical appraised research and papers. You mentioned flossing. Now, is that flossing more specific to in the shower or just or just flossing?
Just flossing,
Okay.
period.
Flossing
The in
pair.
the shower is my way to get people to be consistent because
Right,
just about
right,
everybody showers daily,
right.
but and people who floss don't floss daily. If
Gotcha.
I had a nickel for everyone says, well, maybe every other day, three
Yeah,
times a week. But
yeah.
if you're
Key
doing it in the
words.
shower, be more consistent.
Yeah, key word maybe. Maybe. Yeah, okay. You just told on yourself. We get it. So, flossing, uh, maintenance and care for your oral health every 4 months, right? Based on the literature.
Right,
Uh,
and you're
s-
just adding one more than you would typically. So it's nothing that's going to break the bank or change your habits totally.
well, and patients will say, well, I only want the six, my insurance only covers 6 months every six, twice a year. So I don't want I don't want the third one, every 4 months
I
because insurance don't cover it.
I simply tell them, I said, your insurance would also like you to extract all your teeth, wear dentures, and keep paying them. So the choice is yours, whether you want teeth or not. But your insurance company, I guarantee you, does not have your best interests at heart.
But Dr. Freddie, why won't they pay for it? Why won't they pay for it? If they know what you know, why won't they pay for it? Yeah,
Insurances are in the business of making money.
right, right.
I'm in
Insurance
the
is
business of taking care of you.
right. Two different agendas.
Yep.
Two
And
different agendas.
one of the things I like to tell, especially my older patients, especially when whenever there is upset, it's because there's been a miscommunication somewhere.
There you go.
And the best way for me to turn that around is to say, Mr. Jones, I work for you and I don't want to lose my job. And if that doesn't kind of make them feel more empowered, then nothing will.
Yeah. Key again, everyone's listening, watching. Communication. Communication.
I
They are
don't care
not.
if it's with a significant other. When there is miscommunication,
Yep.
that's when upset shows up.
Well, that's why the word is called what it is. Miscommunication means you missed some communication. You missed saying something that someone could understand and they don't understand. So there you go. Any other tips for patients or health advice that you give to them? You mentioned flossing
As
every
a
4 months.
as a dentist, you've got to stay in shape. When I first started, I kind of poo-pooed
Tips
the
for
old
patients
ergonomics.
that you share with patients or just for yourself?
Well, this is for folks listening.
Well, what about for the health advice? Any other health
Oh,
advice that you give
well,
for
yes.
patients?
Um, Periodontal disease is like diabetes. If you don't manage it, it just comes back.
Yep, yep.
But
And
as far
some
as
people,
patients, that's the big one.
yeah, and it's a big one also, unbeknownst to them, because there's a link between the two as well, which is another conversation related to the integration of oral health and medicine and why the mouth matters, why oral health matters, and it's not just about teeth, right? It's about the other things that unfortunately only I would say the majority of us know as dentists. Our
So
other colleagues don't know as much, right? So,
digestion begins in the mouth.
yep,
How many times do we have patients that say, oh, well, they're the teeth in the back. People can't see those. Well, what most patients don't understand is number one, those molars in the back protect the teeth in the front. And when you take the molars out, the teeth in the front begin to take on trauma and damage that they weren't meant to. But more importantly, I believe, and I don't know if there's any research out there, but colon cancer is very high in the Black community.
Mm.
And I believe one of the reasons is missing teeth, missing posterior teeth. So what's happening is we're eating food before it is properly digested in the mouth, now sitting in the colon and gastrointestinal system, causing ulcerations there because the body's being asked to break it down with the acids that break it down, but it's sitting or laying in the body, then commuting into different tubers from the ulcerations.
Yep. And there also are many digestive enzymes that are in saliva that help with that digestion and digestive process as well. All starting where? In the mouth, which is part of the head, which is attached to the body. So again,
Good
whole
health
nother
begins with the
discussion.
mouth. Yep.
Yeah. Yeah. Well, everything begins with the mouth, right? You talk,
Sure.
you smile, you eat, right? Anyway, uh, tips, tips and advice for aspiring periodontists, implantologists, four mouth, restored, restorologist, with the focus being on the foundation, right? You can't build, well, unless you're in Dubai, you can't build these these buildings in these cities on the water by the water itself. You got to have some
Even,
foundation, right?
even those cities have tunneled down to the foundation.
Tunnel down. I mean,
Yes, sir.
deep, 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 deep.
Yeah.
But tips and advice, knowing what you know, what you've experienced, what would you tell? What are three things that aspiring periodontists need to know right now?
Number one, um, periodontal disease is something that is running rampant, especially in our communities. And no matter how you do it, you're going to have to develop your own special way of getting that message out and create your own way of communicating that problem to people who have it. Also, uh, education for a lifetime. Stay abreast of what's going on. I've been a member of the AAP since I graduated, and I may not read my journal in depth, but I'm always at least looking at the table of contents to make sure that I'm abreast of what's happening in the world of periodontics. And if I see something that interests me in particular, of course, I'll delve into it. But I'm able to keep abreast of where research is going, what's happening, and who the people that are doing it are. The other one is uh, do your homework in terms of investing in technology. They say that we as dentists love gadgets and all these other things, but because technology is going where it is going, it is very easy to spend good money on stuff that just doesn't work well. And I'm not telling you that because I read about it. Okay. I bought a Carestream intraoral scanner. And if I compare that with the Trios that I now use, I mean, I'm almost pissed at my rep for even selling me that. Right? But I didn't do my research as diligently as I should have because I was so excited to take that next step in getting into this technology. So my advice is to make sure you do your homework, even go places and try it out, talk to other doctors who have it, et cetera, et cetera. But those are my three main tips.
Now, and thank you for those. What about tips for those that are dental students or those that have finished dental school and maybe they've been doing some implants, but they realize they want to step up their game, step up their expertise, step up their skill set and are considering perio as a specialty. What tips do you have for them who are at that stage, making that decision, applying, thinking that they want to apply for a perio program?
Again, do your research on all the schools that are available, know who the directors are, and know the director's history. In conjunction with that, make sure that your financial house is in order, meaning you don't want to be in school with all these credit card bills and miscellaneous bills because that's just going to be added stress. So make sure you're in a position or prepare. So if you're not in position this year, maybe you will be next year if you focus and put yourself in that position. You want to be in that program so that you can give your all to that program, because when you come out, it'll be more than worthwhile. The other thing is associate or go meet your local periodontist. Do what they call pick their brain, find out why they're doing it, see what the climate is in your area. Why did they become a periodontist? How's business, et cetera, et cetera. And make sure that when you go in, you are committed to finishing. Don't go in and do 2 years and leave. Commit yourself to finishing.
That last one, commit to finishing. Would there be a reason for people not to finish? What has happened?
It's no easy journey,
Right, right,
and I don't think there is a program that doesn't have a way of wanting you to get the hell out of there because of how you are not necessarily hazed or indoctrinated, but how they feel you need to be treated in order to make sure you can represent them. In other words,
right.
if they can get through this, I know we're putting out good doctors.
Right. And that is something again that Dr. Fraser mentioned, we talk about all the time, you know, determining fit. And now all of that starts at the beginning of your process of coming up with your list of programs and doing your due diligence, right? Investigating the
Crucial.
programs, going to visiting the programs, making sure that you go to maybe go to the Perio meeting and network, meet people, meet the residents, talk to the residents, get more of a direct insight into the program because it's got to be a fit, not just for you, but for them as well, because you are a product of their program, which means reputation. And unfortunately, the program is bigger than the resident, meaning the program was there before they started and it's going to be there years and years after you finish and become board certified. The program will be there and it will sit in the community delivering those services to the people after you're gone. So it has to be a good fit for them as well. Um, some really great tips, Doc, both from the clinical side as a periodontist, but also as a future trainee in perio as well. Last question, last bonus question. If you could change one thing, like my finger over, where's it at? Like my finger over here. If you can change one thing about the dental profession, what would it be and why?
If I could change one thing about the dental profession, I would make it more accessible to folks that look like you and me. We're highly underserved, and we're highly underserved because there are so few of us going to dental school. So if I could change one thing, I would make sure that more of us were in dental school and perhaps even starting a full program. But the one thing I would change is having more of us become doctors.
Well, there will be individuals that say, as far as the doctor part, that there may be more that are going into pharmacy, nursing, and then getting their doctorate of nurse practitioner, or just as in, medical school as a physician. But there's something maybe about dentistry that may be less appealing, or more appealing, right? At the end of the day, your point is well taken as it relates to accessibility. Um,
One
and
thing I will say, Darn, real quick,
yeah,
for anybody who uh, deems dentistry either not on the same level or something different than being a doctor, they haven't done their research.
Right.
And what I found, I never forget this. One time I was at Temple, and this young lady told me, she said, "Oh, you're a dentist. That's on the lesser end of doctor. You know, we're talking about being called doctor." And I realized that people who haven't done their research think, "Oh, physician, that's the creme de la creme." But what we have to realize is not only is it just as challenging, it's more challenging simply because everyone that comes to see you, for the most part, has a
Hmm.
problem. Now you fix it. It's not, oh, take two of these and call me in 2 weeks. It's like, okay, well, I've been here for 2 hours. Is it fixed? You've got to be a problem solver on the spot. And if you're not any good at that, you're going to have real issues. And I say that because dentistry, or at least once upon a time, was the number one profession with suicide.
Yes, and it
I
still
believe that's why it
ranks.
is.
It still ranks up there.
Yep.
Ranks up there. And as a sidebar, I think a lot of it has to do with some of the pressures, so based on the training or lack thereof, the debt that's associated with for the actual training to become a dentist, and that gets added on whether for advanced training and to open up your office to be an owner, practitioner, etc. Right? And not having all the tools that's needed for you to be successful based on the timeline and when you're learning these things and you're being exposed to these things. That has a lot to do with the suicide, but also just frustrations for any profession, right? It's the access to information, doing your due diligence, and making sure that you're connected with the people that are doing or have done what you want to do, so that you're learning
Well,
from those examples and not becoming an example of bad experiences or bad decisions.
there was a time when if you became a physician, you graduate and you go out and you open up your office. How many physicians do you know now that have their own office? Most of them are working for hospital systems or insurance companies or whatever the case may be.
Yep,
Dentists are one of the only healthcare professions that still have an entrepreneurial spirit at its core. And,
absolutely.
and in being an entrepreneur gives you something that nothing else will.
Yep. And it's key. We'll talk about accessibility to dental school, but also as dental students, having accessibility to what that looks like after dental school. Because unfortunately, it's still not enough time to teach you everything clinically that you need to know as a dentist in school. And we haven't even touched upon the business side that's waiting for you, or the entrepreneurial side, or just how you're able to deliver oral health care as a business or as a way of living, right? To be compensated for your expertise. So
Yeah, making a living.
yeah, making a living. Well, that's the part that a lot may not have access to early on. But your point about increasing access to dental school starts with conversations like this, and ones that you all have been listening to on the podcast show, on the channel. So continue to listen, continue to watch, continue to learn, continue to share this information, so that it is in alignment with what you're doing and how you're developing your career, both professionally and personally as well. Um,
That, that reminds me of something a professor once told me, and it just rang right in my head. One time, I think I was, maybe talking to someone that was sitting next to me, and he goes, "Excuse me, Dr. Fraser, where else, where else are you going to get this information?" And that's what I feel right here, folks. Where else are you going to get this information? You got to tune in.
Yeah,
Where
gotta
else?
tune in.
There's
Gotta
nowhere
tune
else to
in.
get this information.
Yeah. Two last questions related to getting information. How do we increase access to dental school for those that maybe traditionally have not gone, or those that would be representative of the populations that need dental care the most?
Exposure, early and earlier exposure. That's the only
Hmm.
way. Earlier and earlier exposure.
And when you say earlier, what do you mean by that?
I mean, elementary school. I mean, when your children, or when children in general go see the dentist, or even having a dentist come in and speak to kids, to just give exposure that this is what is possible. Because when you see people that look like you doing something, you now have the belief that you could do it too.
Yeah. So it sounds like accessibility starts early, as in getting them more exposure, and that will also lead to exposing them to access points, whether it be through scholarships, mentorships, shadowing, all the things that help individuals make a decision, or make the best informed decision for themselves as it relates to dentistry being their chosen profession or way of life. What's the best way for people to contact you if they have some more questions as they're navigating life, navigating maybe perio, and making those decisions similar to what you've done over your journey? What's the best way for people to contact you?
You can contact me at drgordonfraser.com. DrFraser.com. Go to that website. All my information is there. I'd be more than happy to talk to anyone. Anyone wants to come visit, chop it up, whatever it is I can do, I'm willing to do.
And keep in mind, and thanks for that, Doc. Keep in mind, that's related to perio, that's related to implants, that's related to communication, that's related to being an owner, responsible for a team, all of that, and also related to being an entrepreneur, right? Too. Um, that's all related. It's all related because you wear all those hats, and that's part of what you encompass as a professional. Well, this has been a great professional development opportunity for those of you listening, watching. Hope you liked it. Please share this, but also we hope you do this, which is go to the next episode. Go to the next episode right now. Go, go.